The odds of patient death increase by 7% for each additional patient that a nurse cares for at once. My name is Ariana Pittman, and I am a patient care technician at our hospital, and I am here today to tell you that patients are having negative experiences due to unsafe nurse-to-patient ratios. The main points I have gathered today are patients are at an increased safety risk when nurses have too many patients to care for. Patients are feeling like just another number, and patients feel that they are not being properly communicated with. These points all lead to dissatisfaction of patients in the hospital and burden falling on the nurses. The first point I will bring to you today is patients are at an increased safety risk when nurses have too many patients to care for. Patients are more likely to fall when they cannot reach their nurse to help them in their room. When a nurse has 7 or even 8 patients, it is impossible to reach each one of those patients at the same time. This is an immediate safety risk for our patients. Some of these patients are on diuretics that cause them to need to be taken to the restroom more often. For example, if 3 fall risk patients are very eager to use the restroom and the only people available are you and your technician, one of those patients are going to get up without assistance. This is a breeding ground for falls, which we're seeing very frequently. Another safety risk to our patients is when dealing with medications. Important medications are being administered late when the nurse has too many patients to care for. For example, if a nurse is administering a blood transfusion, they may not be able to leave that patient's room for 30 minutes or even more. In that case, if another patient is requesting a medication or even has one scheduled, they are not able to receive it until the nurse is finished with the blood transfusion. This causes patients to be upset that they do not have their medications on time. The second point I will mention today is when the nurse-patient load is too high, patients start to feel like just another number. Something that we commonly see is nurses referring to patients by their room number because they are caring for too many patients to remember each person by name. This can cause the hospital setting to be very dull and for patients to feel unimportant. Nurses may also get patient names mixed up. For example, if a nurse is taking care of too many patients, they may not know who it is that is coming up to speak to them at the nurse's station. In this case, they will have to ask the patient or the family member for their name and look them up in the system to see who they are and see what questions they can answer for them. This makes the patients feel that their nurse doesn't know them or what they're going through. This leads into nurses reading from computer screens to know who it is that they're dealing with. Nurses can't remember every single patient diagnosis and plan of care when they are taking on too many patients at a time. Nurses tend to have to read from their computers, which then puts the machine between them and the patient, causing the interaction to feel less genuine. The third point I will talk about today is patients do not feel like they are being properly communicated with. Nurses may confuse which doctor is assigned to each patient, causing miscommunication with the patient. Some patients may have 3 or more doctors assigned to them or consulted for them during their hospital stay. If you add that to nurses having 7 or 8 patients at a time, that leads to a lot of miscommunication. This makes patients feel as if the nurse doesn't know what is going on with them and they don't know what their next step is. Nurses are also discharging and admitting multiple patients at a time. With nurses already having so much going on with their other patients, Those patients awaiting discharge don't know when they're going to go home or what their next step is. For example, during season, a nurse may discharge 4 of their patients and have another 2 or 3 admissions over the duration of their shift. As soon as the patients are aware that they're going to be discharged, they immediately want to leave the hospital. This might not be the case for the nurse. If the nurse is working on 2 or 3 discharges, she may not be able to speak to another patient about their admission or pending discharge. Coupled with high patient load, this causes nurses to be rushed and patients to feel like they aren't getting proper communication. In conclusion, our patients' experience is based on how our nurses are able to care for them. If our nurses take on too many patients at a time, they are not able to give each patient the care that they deserve. Today I mentioned that patients are at an increased safety risk when nurses have too many patients to care for. When the nurse's patient load is too high, patients start to feel like just another number. And patients also feel like they aren't being communicated with properly. With the information that I have presented today, I hope to have enlightened you to the problem of unsafe nursing ratios and how it is affecting patient experience in the hospital. Thank you.